What's the role of an OBGYN, midwife, and doula? Are you seeing blurred lines?
About this. So let me introduce our guest. We have Ms. Keesha Hernandez, who's on the couch with us today. She is a doula and a prenatal and a postnatal yoga teacher. So she's yes, isn't that pretty cool, right?
Yeah.
Exactly. So we are going to talk about one of the things that I have discovered, you guys, when we started being on social media, specifically on Instagram. I started following other birth workers that are in the same field, trying to be a part of the community, make sure that we're introduced to the community. And one of the things that I found, one of the things that I experienced was a little alarming to me. So I wanted to really discuss where are we going? What is our goal? What is our message to women? So I joined on this Instagram live where it was a Caucasian OBGYN having a discussion with a very popular doula. And in that discussion, they were talking about what can we do to help women of color have safer outcomes, given all the statistics that we've heard about, 3 to 4 times more likely to die related to pregnancy, right? We're talking about Black women, but we're not going to forget that it also affects our Alaskan natives and our Native American women as well. We haven't forgotten that. So I chimed in with a few suggestions in my comments, and I was actually mocked. And it was interesting because I'm a Black female OBGYN. So I figured I probably have some contribution to the conversation. And I thought it was really interesting that my comments were dismissed. And my question is really, where are we going? So I started to follow other doulas as well, and I'm realizing that there are some doulas out there, not all. There's some fabulous doulas like the one we have on the couch this evening. But there are some doulas who are actually giving medical advice. And I do find that alarming. People are getting confused. Who's a doula? Who's a midwife? People are saying, I want a doula to deliver me. I'm like, whoa, wait. What is going on? Let's talk about it. Let's talk about it. So
Mhm.
let's talk about what's going on in this space. We all want the same outcome. We want women of color, especially Black women, to have safer births. But how do we get there? So Keesha, help us out understand what is a doula. Let's start there.
Okay, so what a doula is not is a medical professional. That's some ways helper that some of those ways of just pointing out what a doula isn't can help you transition into understanding. So, okay, a doula is not a medical professional, not a midwife, not someone who's going to deliver your baby, catch your baby. Anything that requires medical attention, any kind of medical answers as far as where you are with ages and stages, where you're feeling, where you're at, a doula is. I'm here to provide emotional, mental, spiritual, physical support that's definitely disconnected from the medical side. So I look at my work as a birth companion, a sister, a friend, a support system for you, an additional support. I'm there to guide you through any answers you need. I'm here to vent to. I'm here to help you and your laboring partner connect on a way that you feel most connected before your birth. So I'm really connecting moments of balance between the mind, body, and spirit. That's how I see it for my work. That's how I come at it at that angle.
I love that. I love that. And I love this the fact that you mentioned that part of your role is to really help the relational aspect of giving birth, which we sometimes don't pay as much attention to. In the whole conversation of helping Black women survive childbirth, survive pregnancy, what do you see as your role in that particular conversation?
I see my role as an advocate to support what they're going through as real. Your emotions are valid, your pain is real, and I'm here to help translate that to your midwife, to your OBGYN, to your laboring partner, anyone in the room. I'm here for that support. And I think that there are certain moments where we're unsure, or that mom is unsure of what she's feeling. She asked me for an opinion And I'm here as support, and I make sure that I always tie it into, okay, let's also revert back to your midwife, to your OBGYN. Like, I want you to know that I'm not there to answer those kinds of questions necessarily, but I am, as far as medical concerns go. But I am there to support you, to remind you that what you're feeling is real, it makes sense. And I want to always make sure that I talk to my clients, letting them know that I hear you, I receive the message, and we move from there. So just supporting in that way to make sure that they know they're not going off the deep end in any way.
Right. And Olivia, we've talked about this on some occasions. Why do you believe that there's such confusion between doulas and midwives? Where is that coming from?
So I've talked to midwife colleagues about this.
Uh-huh.
And I was like, what are doulas doing right that midwives are not? Like, why does everybody know what a doula is? When I say I'm a midwife, why does everybody call me a doula? And I was like, do they just have better campaigning, advertising? Like, what is it? And somebody said to me something that I didn't anticipate or even think about, is that anybody can become a doula, right? If you're interested in birth work, you can take a weekend long course or trying with somebody, however the steps are to become a doula, because I'm not even that familiar, but it does not require you to have to go to school in such in depth like a midwife, right? And the responsibility is different. So you can be a total advocate for birth, love birth, and be like, I'm going to support birth in this way. And so because of that, the world of a doula is very accessible, much more accessible than the healthcare providers side of it. And so she thought that that was why people were so much more familiar with doulas. It's because, listen, you know, you had a home birth, you loved it, now you went and you became a doula, you know what I mean? So it's word of mouth, it's people being like, my doula was amazing. And let's be clear, an amazing doula is life-changing. You hear me? A good doula is clutch. Just like a doula that's not that great is, yeah, a whole lot of things. But I think that's why too, when you have an amazing experience with an amazing doula, and it's like that changes your life, and then you see a way for you to participate in this amazing birth thing that you love, that does not require you to uproot your life and change everything and have to go to school and get a master's or a bachelor's or become an MD, you know? So I think that's why.
So are you saying that there is a quicker growth of doulas than there are? What do you guys think? Are there more doulas now than there are? Dr. Trista shaking her head.
Yes, actually, and when I think about it, I have colleagues from college who are, so one friend is a teacher. She teaches math and science. She's also trained as a doula. My sister, I can't count her because my sister has like 3 different things behind her. She's an LMT, she's an RN, and she did the doula training. And she was doing doula work before she even did, like, she doesn't count, but I know more people who are doulas because they've just been interested in supporting other moms. But one of the other things too, and I can't say that I know this for sure because of that, but we also have to think about the effect of our celebrity world and what they're saying, because I have a feeling there's been a lot more talk about, oh yes, me and my doula did this, but you may not hear them say they're a midwife. They may have delivered with an OB, but had a doula. And so it's like, now that gets connected. Oh, well, such and such had, and I don't know my name, but such and such had a doula. So, this is the thing now. We all have doulas. Don't get me wrong, I had a doula. But
right. I think it's the accessibility. It's like you said, I think it's the accessibility. What do you think?
But I do have a question. I'm not a mom and I haven't given birth, but my question is, what was lacking that there needed to be a need for a doula? How did the profession come to be? Because if you're in a hospital, you think your doctor has a good bedside manner, you have nurses, you have people there to support you. How did Keesha, how did a doula or the profession come to be? Like, what was lacking that this was created to fill a certain gap? Like what was, or anybody, like what was happening or not happening, I should say.
I think that's a great question. Okay, so just to give an example, my brother and his fiance, they just gave birth 6 months ago, and they were young and they're Black, and they didn't receive the care that they deserved. And through that, they look to me for some support. And I'm like, yes, let me help connect. Let me help bring you guys closer in communication with the medical staff, your providers. When I walked in with them in the hospital, immediately they said the communication changed between me, or between them and their medical staff. I think that there are some moments where you have a disconnect between the medical providers, the nursing staff. They're not able to have that one-on-one support throughout the whole experience of labor and delivery. So there became a need there for some one-on-one support when, let's just say, there's 6 different people laboring on that floor and there's only 4 nurses, or everyone is busy at that moment, and you need something specific. Maybe it's even getting ice, and you don't have that because everyone's busy and they're overworked and overstaffed. So I think that's where one of the perspectives comes into play with needing or filling that gap with a doula.
Yeah, and on the OBGYN side, I think Keesha touched on one of the major issues, which is the ratio of doctors to patients and the ratio of RNs to patient. And so, and also understanding the history of OBGYN to begin with. So OBGYN started out as a white male field. And it's only in recent years that we've seen a shift where we have more women becoming OBGYNs, and we're having actually less men going to the field as well. And it is still one of the more common fields that you will have female Black women or women of color go into. So when women of color are more likely to go into family practice and more likely to go into OBGYN as compared to some other fields, but it's still lacking. You're talking, there's only 2% of us, period. So 2% of Black females are physicians across the board. And so when you calculate that down to a population of birthing women of color, there's no way that we're going to match those numbers. It's impossible. And then thirdly, the American College of OBGYN has projected that there will be a shortage of up to nearly 9,000 obstetricians and gynecologists by last year.
Oh,
Yeah, and also like you said, accessibility and the fact that research shows that women do better when they have labor support. So research shows having a doula or some type of labor support is as effective as epidural anesthesia. And so when you're hearing all of these things, when you hear the research come out that says, you know, doulas save lives, doulas save Black women lives. Yeah, it's the labor support, right? So you have this specialty of women who are trained in being great at labor support. And like I said before, I really think it's the accessibility, like you said, Dr. Trissa, you know, somebody has a great doula and then it's like, oh, I love this birth. Like you said, Keesha, I went and I supported my brother. And so I was like, this is amazing. Now I want to do this. And you can, right? You can do it very quickly and you become good at it. And you can be a total professional in something completely different and be a doula. And so I think that is the brilliance of doula as an institution. But it's essentially labor support, which, you know, most people can do.
Right. And let's also add to that the historical factors, right? So as people of color, historically, we have had village workers, village women who delivered babies, which is sort of the origin of the midwifery practice, but it's sort of this supportive community environment that is our history. And so that history is now coming back to meet us, and it's such a great evolution of women's health. But again, we have to make sure that these lines are very clear so people understand whose role is what, and so that we're working together to hit the goal of really helping women of color. Because I was in one chat, another live. Yeah, I do have a life, y'all, but sometimes I'm in the chat, and I was in another live, and the conversation was that birth workers were going to save Black women alone and bump basically and exclude women and exclude the obstetrician. And so my question to you guys, is that possible? Can we help women of color? Can we meet those needs and measures without each other?
No,
Absolutely
not.
You need that support of the community. And that's what I think is lacking, this transactional approach, even with doulas. Okay, I'm going to come in and out, and I'm only there for a couple of prenatal meetup, and that's it. I find that you need more. We need to create more of a system where we're looking at it as a humanistic approach. Like, let's get to know each other in this journey that you're on. Let's continue to also create that bond between you and your OBGYN, you and that midwife. Like, we are a collective. It takes a village. Let's continue to spread that knowledge out there and do the work one-on-one to fuse them all together, that we all can have this moment together of clarity, to find this peace, to find solutions to improve the care that we have in maternal health.
100%. Like, Keesha and I have done births together, and I'm always like, you know, the thing that I've just liked the most, and we talked about this, ladies, on here too, is that I feel like all of this information about Black women being more vulnerable has done a lot to make us more afraid. And so now you have people in instances where you need OBGYNs, where it's very clear, it's clear to everybody, the doula, the midwife, everybody. But now we have everybody so incredibly afraid, even when it is appropriate, even when actually the safest place for you is the hospital. The safest person for you to take care of you and make the calls is the OBGYN. And now we've kind of created, like Dr. T, like you said, you're being in these rooms and you're like, this is crazy. Like, there has to be a time and place for all of us. And yes, most women, when you are healthy, if you are appropriate and things go well, hell, you could birth on your own. Let's be clear, right? You always want a skilled birth attendant there, because I always tell women, you want to feel like at the end of the day, you liked your midwife, but you were like, hell, I could have done this by myself. I did this, me and my husband did it. And that's what you want to feel like. That's a beautiful birth, where you feel empowered and you're like, I didn't even need you. But you also want me there for those times when you felt like, dang, if the midwife hadn't been there, if the doctor hadn't been there, right? That's what you want a skilled birth attendant there for. And an OBGYN is a part of that, right? You are a part of the skilled birth work team. And to pretend like you're not needed is crazy, because when it comes time to saving somebody's life, for whatever reasons of whatever happens, who does everybody turn to look to?
Yeah, and it's interesting because I feel like we're having these separate conversations, and I'm going to ask our other two moms on the panel to share their experiences, because I know one had a midwife. I'm not sure. I don't think Karen had a midwife, but we'll talk about it. But to your point, Olivia, what I find is interesting, because then I go into OBGYN rooms on other social media platforms. I do have a life. Trust me, guys, I do have a life. But I'm in these rooms, and we're not having conversation with doulas or midwives. We're in separate. I'm in everybody's room. Let's make that clear. But we're in separate rooms, and so I'm just really concerned that we're not coming together with caring for women to have these conversations. And to your point, Olivia, we are finding that, like in trend with the entire population, moms are becoming less healthy. So we're having more underlying cardiovascular diseases, things that make us a higher risk. And so this is why it's even more important to make sure that a practitioner is on board who can take care of a higher risk issue, because that's the more likely cause of the deaths that we're finding. Cardiovascular disease is the leading cause of deaths related to pregnancy. So the question is, why aren't we having these conversations where everybody's involved? Like, what was your experience like, Eunice?
Hi, ladies. I actually did have a midwife, and my sister was my AKA doula. She was just there with me in support, and she actually ended up getting certified as a doula afterwards. She helped during the whole process. My midwife was incredible. I ended up having to get Pitocin. I had to get induced. I ended up having to get an epidural. Everything that was out on my birth plan I ended up having to get. But my midwife was awesome. The OBGYN never had to come into the room. I ended up dilating fully at 10 centimeters, and I ended up having a natural birth. There was a point where they thought if I didn't dilate, I was going to end up needing a C-section. But with the help of my sister, who was incredible, and my midwife, I was able to give vaginal birth, and there wasn't too many complications besides being induced in the epidural, which wasn't something that I wanted, but it happened, and it is what it is. But I say all that to say that, yeah, I think that doulas and midwives, especially doulas and midwives of color, we need them. We need them tremendously in our communities, because another thing that I experienced when I was looking for a doula, I was in graduate school getting my master's. I was broke. Okay. I didn't have doula money. And when I was living in San Diego, having a doula in San Diego was like a luxury. Like these ladies were charging $3,000 to $5,000. I didn't have that. And the majority of all the doulas that I interacted with were all white. Very
Mhm.
seldom did I run into a Latina or a Black doula. I know that it's starting to change now, and I'm happy for
Is it?
that. Yes, I've met a lot of doulas of color. I've met a lot of women. My cousin's wife, who was Black in New York, had a Black doula. She's Black. So yeah, so we're starting to see, I feel like we're starting to see some changes in that community where it's more reflective of people of color. And I hope that it only gets better with time and more education. I think that there needs to be more education, that there needs to be accessible to lower income women or middle class women. Like it's just not something that I would hear like conversations when I was pregnant, like these women, and predominantly women of higher SES, predominantly white, would talk about their doulas like it was like an accessory, you know? And it just, for me, I just kind of internalized, like, well, I can't afford that. Like, I can't, that's not out of my reach. That type of thing. I
Well,
felt like it was not, I wasn't part of that club.
well,
Does that make sense?
let's find out about the numbers. I think you raised a good point. What are the numbers? What percentage of doulas are people of women of color? And what percentage of midwives are women of color? That's a good point, Eunice. I shared the doctor side. What are your numbers?
Don't get me lying, you have to research. Not a lot. Not a lot. I think there's something like 2,000 Black midwives in the US, maybe out of 15,000 midwives. I could be making that up, but yeah.
I've actually heard, I think you are, if not on it, near it, because I've heard numbers similar to that in
Yeah.
some of the rooms. What about doulas? What are our numbers?
I would definitely need to research more of that. I mean, as far as my community, I definitely know we're growing. But numbers, I'll research that and get back to you.
Yeah. Let us
I
know,
will
and
say,
we'll add it to the post. Go ahead.
I
Dr.
will say
Trista.
one of the things that I know there is and this is back in New York City, there is now a push for making it more accessible to those of low economic standards. So one of our college classmates, she helps to run, and she is a doula, and she helps to run an organization that helps to supply doulas for women who may not be able to have, you know, all the financial support for it. So I know that it's growing. It's definitely becoming more more, I don't want to say trendy, but it's definitely becoming more in the forefront of what people are looking to do. And the numbers are increasing. My doula happened to be white. It was based on affiliation. She knew my sister, and so that was where that came from. But there are a lot more, I now know a lot more Black doulas than I do white doulas.
Wow. And
Me
you
too,
bring up a
Trisha.
good point. Huh?
Me too. I know more
Yeah.
Latina and Black doulas than I do white doulas. I think I met my first white doula the other day.
Oh.
All right.
But when you Google doulas in LA, I will say white doulas come up real quick. So my question to you guys also, Dr. Trista bring up a good point about, and Eunice, about the cost. So how do I afford a doula if I'm a woman of color and I'm socially economically disadvantaged? And for Olivia, my question to you is, I know you do home births. So how do I afford a home birth if I'm interested in doing that?
Keesha could talk about affording a doula. As far as being a midwife, you just have to search around like people do. And most midwives, especially midwives who are used to taking care of their communities, are willing to work with you on their price. Most. So I always encourage everybody, don't be afraid to be honest about what you're working with and what you've got. So for example, when people come to me, I'm like, this is my price. What can you afford? And then when they tell me what they can afford, I'm like, if what you can afford feels like honorable to me and I'm not upset about working with you, because then we're good, right? But I always let them know what my actual price is, because I want them to know what it is, and then they can tell me what it is and we work. And I have to be honest, most midwives that I know that serve Black and brown people, and actually some of the white midwives I know too, will do the same. So most of the people who work in the community are willing to work with you, because most midwives believe that a woman deserves and should have the birth experience that she wants.
How do we find you guys? Like, how do we find, if I wanted to have a home birth, how do I find, outside of like asking my actual OBGYN, or if I'm already being seen by a midwife, how do I
So
find?
There are web pages. There's midwife.org. I know that's ACNM. That's the American College of Nurse Midwives. I believe there's one because there are different type of midwives. They're licensed midwives as well. And I'm not sure what the websites are to be able to reach them, but you can also Google midwives near me. And a lot of people just ask around because a lot of people shop around. So you'll talk to one midwife and you'll ask, or a doula. Doulas are great referrals for midwives. So it's like talking to a doula and be like, and so people then, you know, if you talk to me and it's like, oh, you know what, this is my price and we had a great conversation, but if you're looking for more people, then I give them 2 or 3 more names and I give them their contact info or their web pages and things like that. But I can't speak for the licensed midwives, and I'm ashamed to say I should know this. Like if there is an actual
wait. Don't just rush past that part. Put a pin in that part.
Explain.
What are you talking about? Licensed midwife? Hey. What are we
Explain, lady.
Explain. You got a lot of you got a lot of to do.
This is a whole episode on the books in itself, but just in brief, there are in the United States, there are 2, some would say 3 different types of midwives, okay? You have certified nurse midwives who all had to be licensed first as registered nurses and then went along to get their master's degree in nursing or in science to become a nurse midwife. That's what I am. You predominantly find them working in hospital settings. Our scope of practice is slightly different. We prescribe medication, we first assist in C-sections, and we work in any birth environment, home, birth center, or hospital. We're recognized in all 50 states and in other countries. Then you also have the licensed midwife, and the licensed midwife can be different. So there are different paths to licensed midwives, and we should have one on because they're great to tell you what the paths for their specific licensure is, but there are different programs and ways to become a licensed or professional midwife. It can be a 4-year degree, like a bachelor's degree. Some do apprenticeships. There is a board that they can sit for, the NARM, I believe it's called. So it's slightly different, but the requirements are not all the same. And so those 2 different kind, and there are some amazing licensed midwives. Most of the licensed midwives I know, like, yes, and they are trained in some gynecological things, and in different states there are different rules. So in some states they're outlawed, they're illegal, you cannot. In other states they have a lot of autonomy, and for example in the state of California, in Southern California, they're not given a lot of autonomy, but in Northern California they're seen almost the same as nurse midwives, and they work under the license of a physician, like in a clinic, and they'll do family planning and they'll do birth and things of that nature. So it would be super interesting to have a licensed midwife on because they could speak more to those things. And there's always been this thing with licensed midwives and nurse midwives that I'm hoping that we can bridge one day. But you know, nurse midwives are traditionally more white, right? Because it was access, right? Education, money, those type of things. So yeah, so different kind of midwives. You can call them professional midwives or licensed midwives or nurse midwives. Okay, the difference.
Got it. Thank you for explaining that. And Keesha, help us understand, how do we afford doulas?
Well, okay, it really just depends on your budget. I think that these days, what is really nice, I've seen a few volunteer programs going on. I believe Happy Baby, Happy Mama out here in LA. I might be getting that name switched around. But with that, Google volunteer programs in your area. They do exist. Also reach out to your local midwife, your OBGYN, to ask for referrals as well. I know that in certain hospitals, even in this area of Palm Springs, they're starting volunteer programs for doulas to come in, test programs. So I know that they'll be branching out as well, depending on success rates and things like that. But I think it is accessible. I think that if you do Google doulas, you will find a significant amount. I think that you would look for the one that speaks to you, interview a few, check out their rates, let them know your budget, what you're looking for, and they can go ahead. I mean, with me, I'll let people know. I'll really ask them, what are you looking for? Why do you want a doula? How can I, and then I'm over here seeing how I can meet their needs. What is your range? All right, if the range is a little lower, okay, maybe we do 8 things instead of 10 things. Like, I can figure out how to work with you. I think that goes with a lot of doulas as well. That goes for a lot of doulas as well. I'm in these Facebook groups and they're constantly reaching out. Hey, who can fill this need. Actually, this family can't afford to pay anything. Is there anyone willing to volunteer their time? And I've seen so many people just reach out and say, yes, me, I can. So I feel like there are opportunities there when you don't have the funds, but then you also have those higher end rates that are available, of course. But I think that with the community that I've seen here in LA and Palm Springs area, we're definitely creating more opportunities for that connection, no matter what your range is.
That's awesome. And before we go, Keesha, help us understand, we talked about birth doulas, but there is also postpartum doulas. Help us understand the role of a postpartum doula for those who may not be familiar.
Can I just say real quick? Can I say real quick before you go, Keesha? Also, some insurances will cover midwives, and some, I know Blue Cross is working on covering doulas as well. So check your insurance.
That's right. Thank you, Olivia. All these changes are happening so fast. I'm like, I can't keep track.
Yeah.
Postpartum doulas. So they're working with the first 6 weeks after birth. They're working with helping you to connect with your baby, breastfeeding, any support that you need as far as maybe like meal prep, organization of your closet, your house, supporting you in those ways. Now, what I realize is everyone has a different philosophy on this as well. So you will have some postpartum doulas that are going to let you know, hey, I can stay for the first 3 months, maybe 12 weeks and not 6. Maybe I can extend also longer depending on what you need, but you're looking at that kind of support just for right after that birth, in any way possible. Massaging, yoni steams, reminding you that you're amazing, those kinds of things.
That's awesome. And Keesha, you know, I'm not going to bring you on the couch and not talk about the yoga, prenatal yoga and postnatal yoga. Why is that important?
Okay, the mental journey that you are on through this process, I mean, it's wild. I'm in awe of all of my clients that I'm working with. How are you doing all of this work internally and providing, you know, all of these kinds of connections with maybe the children that you do have, friends, family, work, life? How do you balance? This is why I'm diving deeper into prenatal and postnatal yoga, is to just help to find some peace through it all. Knowing that you can always turn back to your breath is super important for pregnancy, labor, and beyond. I mean, even me, I'm finding myself just so in a state of peace after these classes, just turning inward and knowing that you have what it takes to move forward through whatever kind of life changes you're going through, internally, externally. I think is an area of focus that we need to work on spreading that knowledge to the masses, because in this moment in our healthcare system, in the world, I feel like we need more of a shift to preventative care, and yoga can help do that. It can help you turn inward, find that connection with your breath, with your body. And in turn, you can possibly find clarity in the way that you move health-wise, with food intake, with hydration, just having those intentional moments of breath really do, I find, connect to all facets of your life that can help you with a more balanced state of mind and body physically. So this is why I feel like if you're interested in prenatal yoga, postnatal yoga, check a class out. I am doing private sessions. I also via Zoom, also on site if you're in the LA area, Palm Springs area. I think that you want to just take time to see if it's for you. It's not for everyone, and I'm not going to push that on everyone as well. So if it's for you, go ahead and schedule more classes. It's also really nice for the community connection with other pregnant lives, that you can come in, talk about your experiences. I have a yoga class right now every other week, and we're out maybe the first 10 minutes just talking about our experience. What are you going through? It's really nice to have that moment of reflection with other
That's
others.
super, super, super. I am so glad that you shared that with us. Where can they find you before we got a few seconds? Where can they find you?
Okay, on Instagram, I should give you my doula Instagram at doula Keesha.
Awesome. And you guys, we thank you guys for following us today. I'm Dr. T, the hand behind the handle of Healthy Bump Club on Instagram, YouTube. Make sure you check us out. And
We love that you are a part of our community, and we want you to continue to be a part of our community. So go ahead and do what? Like the videos, hit notification, and subscribe. We appreciate you guys.